Some of you have asked what's the difference between topical hyaluronic acid serum and hyaluronic that's injected, like Juvederm, that's injected into the nasolabials, the marionettes, the lips, the cheeks, the temple. The real challenge is to find a topical hyaluronic acid serum that can be drawn in through the dermis. Obviously when you're injecting, the needle carries the product deep into the dermis and the epidermis anyway, so it's not a challenge. But when you're placing the product topically, you need to find something and a proprietary blend that can ensure it will be drawn into the dermis and the epidermis. Okay, I'm going to tell you what I used. I use a medium weight hyaluronic acid molecule and a heavier weighted hyaluronic acid molecule, 940 Daltons, and it's attached to a fatty acid lipid tail that draws it into the dermis and the epidermis as best topical can. Obviously the gold standard is to have it injected. Personally, I like to deliver topically these days, but I did spend all my 30s having filler, so I use this under my makeup. So people ask why my makeup is smooth. It's not really the makeup, it's certainly not my application, but I pat the hyaluronic into a moist face and then I put my makeup on afterwards. So this is actually the secret behind my makeup. My makeup takes me 5 minutes to do. Sometimes I apply my hyaluronic with a sponge, but it must not be a wet sponge. If you think about it, if it's a wet sponge, it's going to draw the water into the sponge, so it must be a dry sponge, or else just use your fingers.